Hi everyone. Now we're starting the endoscopy procedure. We first enter the stomach to check the gastric area and make sure everything looks normal. Then we slowly pull back the scope to examine the lower end of the esophagus. This is the area where esophageal varices usually appear. Here you can clearly see one of the varices. We gently apply suction to draw it into the transparent cap that's attached to the end of the scope. You can see how the varix moves inside the chamber. This step must be done slowly to avoid bleeding or mucosal injury. Once the varix is fully suctioned, we release the rubber band around its base. That band cuts off the blood flow and helps the varix collapse over time. The band remains tightly in place over the next few days. The blood supply to this area decreases and the varix slowly shrinks and finally disappears. This method is simple, effective, and one of the most common treatments for bleeding esophageal varices. Now let's demonstrate the same process outside the body using a glove. We use the glove to show how the suction pulls the tissue in and how the rubber band is released around it. This makes it easier to understand how the device works in real patients. Finally, we go back into the esophagus and show the proximal part of the varices. As you can see, they look quite large and prominent before ligation. Banding helps prevent rupture and bleeding, which can be life-threatening if untreated. Thanks for watching. Please subscribe me.